Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex, to self-love, to questions about body parts. Let's get this episode started. Alright, I have some more penis questions for you. Question number 1. My penis is getting bigger, but my foreskin pee hole is closing up more and more. Is circumcision recommended? And how bad does circumcision hurt as an adult? So, it's tough to say for sure without an exam, but I wouldn't jump directly to a circumcision just yet. There are some medications that doctors can provide to help stretch things out and get your foreskin to be able to retract over the head of your penis. That being said, if there's too much scarring or it's not able to stretch out sufficiently, a doctor might recommend circumcision. And so I cannot answer the question specifically of how much circumcision hurts as an adult, but what I can say is it is a big medical procedure, so it's a surgery. It does require anesthesia and some pain control. So it's going to be a bigger deal. And a doctor, specifically the urologist, so the doctor who performs the surgery, can talk to you a little bit more about that, but I wouldn't say that it's immediately necessary, okay? There's some other things you can do, or the doctors can do before then, to help things stretch out. Question number 2. I was recently circumcised, and before the operation, I would ejaculate within 10 seconds of penetration. And after the operation, it's the same, if not worse. Am I normal? So it's tough to say for sure what's going on. I wouldn't say anything about how normal you are, but I would probably expect that this would be a normal reaction after you're first circumcised. So the head of your penis is still going to be very sensitive for a while. And so give it a little more time for the tip of the penis, the head of the penis, to get a little desensitized, and see if you notice any changes a little bit later. But immediately after surgery, I would expect the penis to still be pretty sensitive with penetration. However, if this bothers you and or you want to try to last longer, you can always try putting a little over-the-counter topical numbing medicine like lidocaine on the tip of the penis, so around the head of the penis, about 15 minutes or so before penetration. You do want to wipe it all off completely before having that actual penetrative sex, because you don't want that getting in your partner. So putting that medicine on the tip of your penis should make things a little bit less sensitive and help you last a little bit longer, but I would expect that what you're experiencing is normal after the surgery, but give it a little bit more time. Question number 3. What affects penis growth? Primarily genetics. So whatever's in your DNA is most likely to contribute to your penis size. However, there are some conditions and some abnormal hormone signaling issues that can interfere with penis growth and development, especially during puberty. So if you are experiencing any concerning lack of growth, or if you have any questions about your penis growth, it's worth talking to your doctor just to make sure that there's nothing else going on, that there isn't any abnormal hormone signaling. But generally speaking, the biggest factor of how big your penis is going to be is related to how big your father's penis was, or your grandfather's penis. So, genetics. Question number 4. I have these bumps on my penis and I'm too scared to see a doctor, but they look like Fordyce spots. Flesh-colored bumps and spots on my penis. How can I know for sure? So honestly, there's no way to know for sure unless you talk to a doctor or compare them to other images that you might find on the internet. Be careful. But you might find other images that give you some reassurance online. But the only real way to know is by asking a doctor. That being said, There aren't really any other medical conditions that cause little bumps on the shaft of the penis and on the testicles that look like little pimples. There's really nothing else that would cause that. And so if you are sure that it is not an infection, so if you've never had sex or have any concerns for sexually transmitted infections, it's been there for a long time, and it hasn't really bothered you, then it's probably Fordyce spots and not anything to worry about. But those are some things to think about. Question number 5. When I pull my foreskin back, it only goes halfway and seems stuck, like the foreskin does not separate from the glans. What should I do? So this sounds like something that's super common. It's called adhesions. So it's just it's kind of like a lot of skin bridging around the head of the penis. And usually people outgrow that as the penis grows and stretches, but not everyone does. And so the best thing you could do is talk to your doctor about it. They can give a topical steroid medicine that should help kind of break some of those adhesions and help it stretch. Never be forceful with it, because that can be more problematic and things can heal right back where they were. So talk to your doctor about it, but it's nothing to worry about and it's nothing emergent. Bonus question number 6. I have this red bump on the shaft of my penis. It feels like there's a hard ball or line thing underneath it. What could it be, and should I be concerned? So it's possibly a lymphocele, so a little lymph node that is enlarged and stuck under the penis. We have lymph nodes all over our bodies, and the penis is no exception. Lymphoceles most commonly happen with frequent ejaculation, so whether that's frequent masturbation or a lot of sex. And that is something that is just a side effect of lots of fluid being circulated through your penis, and a little lymph node can develop. It is not a big deal, and it should go down within the next couple of days or so. If it doesn't, or if it really starts to hurt or bother you, you can show a doctor, but it's probably a lymphocele. And that'll do it for this round of penis questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.